Well, why don't you just advocate for birth control then? Have you ever heard this? I have, lots of times. Hey, I'm Kristan Hawkins. Thanks for joining me today on Explicitly Pro-Life Podcast. And guess what? We're going to be talking about birth control. So I've heard this comment hundreds of times in college campuses. And I think it's very confusing for those who are pro-choice. They don't understand. They don't understand the negative side effects of contraception, especially hormonal contraception. And it's really confusing to them why someone who's advocating against abortion isn't just prescribing what they see as the solution, because they've sadly bought into the lies of the other side that if we just have more contraception, there'd be less abortions, which we know isn't true. So I brought on an expert today, Dr. Monique Ruberu. She is in Philadelphia. I almost forgot in Philadelphia. She's on the other side of my state. She is a practicing OBGYN there. She is a specialist. And she's been certified in NaProTechnology, which means she helps women and families with infertility issues. You can often find her on Facebook doing live chats with folks, kind of answering questions about your fertility, about your cycle, challenges you're having. What I love about NaProTechnology is the physicians that practice NaPro try to get to the root problem and don't just try to mask it by prescribing hormonal birth control, which comes with its own list of side effects. So Monique does this all while being a wife to an amazing husband, or so she says. I've never met him. Also a mother to 5 adorable children. And she also leads 2 40 Days for Life campaigns in Philadelphia. I think we could do a whole episode of feminism because apparently she's living it out. Wife, mother, and physician, and pro-life activist. So Monique, thanks for joining me today. I really appreciate your time.
Thanks for having me here.
Yeah. So I wanted to have you on because I get asked this question all the time. If we do ask me anything, and it comes up, whether it's in person or digital. And I think it's a legit question. So I really wanted to have you on to provide your perspective and kind of lend credence to what I've been saying a little bit, because people go, well, you don't have a medical degree. I'm like, I don't have to have a medical degree. I can just Google things, but that makes them very angry. So I want to have a respected physician on giving answers. But I want to first start with, how did you come to the pro-life movement?
So I was cradle Catholic, born into the Catholic faith, and I was probably what you would say on the fence pro-lifer. Mm-hmm. And what happened was 10 years into my marriage was kind of crumbling, and God really stepped in and he redeemed my marriage. And I was so, so grateful to him that I felt like I wanted to do something for him. I had read Abby Johnson's Unplanned prior to that, and that really just planted a seed in me that the thing I needed to do was to pray outside of an abortion center. So I planned on going. I thought it would be kind of like a one and done sort of thing. You go, you pray, and then I would have paid back. But when I showed up and I encountered those women outside of the abortion center and started talking to them, and one woman actually chose life that day, and it was just so moving, and I knew it was something that I needed to continue. But that day when I showed up, I was speaking to some of the other pro-lifers out there, and they asked me, like, who are you and what do you do? And I said, I'm a pro-life OBGYN. Now, at that moment, I honestly thought that I was a pro-life OBGYN because I was standing up against abortion, but I didn't realize that I really wasn't a true pro-life OBGYN. I was still writing for contraceptives. I was still referring people for IVF treatments, and that's not pro-life. And so when I said, oh no, they asked me, are you writing for contraceptives? And I said, well, yeah, in the case of, medical issues. And their face completely fell. And that was the first time in my life that anybody had ever responded to me in that way. And it convicted me like to the core. And I'm so grateful for that one person that did that, because it really started to make me think. At that time, I knew nothing about NaProTechnology. And luckily, somebody that was there that day dropped off a book about NaProTechnology at my office the following day. When I read it, then I was blown away by the fact that, geez, there are other ways that I can treat these medical problems other than the use of contraceptives. That's amazing. And I was so happy to read that. And for the first time, I went to the drug cupboard, opened up all of the boxes, looked at all the contraceptives, and truly realized that every single type of hormonal contraceptive can be an abortifacient. Mm-hmm. And I think that was the point when I really became pro-life, and I decided that I needed to practice differently and do things differently.
Mm-hmm. So when you made that decision, how did things change within your practice? Because if you had patients you were prescribing birth control to, then all of a sudden you said, nope, I found a better way. Were they willing to come along with you on that journey, or did they say, oh, I'm out of here?
I was really amazed, honestly, that the majority of my patients, I think just because we had such a good relationship, mm-hmm. when I realized why birth control pills weren't the best answer, and I started explaining to them how they worked, most of the patients had just taken my advice to be on the birth control pills simply because they trusted me as a physician. And so when I changed my mind about it and I was able to, explain to them why it wasn't a good idea, the majority of them wanted to come along with me. So I kept several of my patients from my original practice when I started practicing differently as a NaPro doctor. Mm-hmm. And I started attracting a lot more patients from, the pro-life community, from people who just wanted to avoid hormonal contraceptives because they were organic kind of people, and, people in general who just wanted to live a healthier life and wanted to really understand what was going on with their cycles.
Yeah, I mean, that's awesome. I get this, question all the time from pro-lifers of, I am pro-life, but I have to be on the birth control pill because of this medical issue. And I feel so bad because I'm like, you need a better doctor. You need a physician who's going to treat the whole patient and figure out what's going on. So I do want to get to some of those cases because I think it'll be helpful for so many of our listeners and people who tune in, because I think so many of us at one point in our lives was on the birth control pill or had been prescribed the birth control pill. And so we have a lot of questions, but I do want to first ask you, that question of, do you think that prescribing birth control would actually, more people prescribing birth control, more women utilizing hormone birth control, would that actually lower abortion rates in our country?
So no, about the use of birth control, the way that it works is that it thins the inner lining of the uterus and it prevents implantation. Mm-hmm. So when people are using birth control to try and prevent pregnancies, a lot of women are having unintentional abortions early in their cycles without even realizing it. Mm-hmm. So that's one aspect of abortions, that they don't even want to have an abortion, but they're having abortions. And these are women that don't have a cycle, and all of a sudden out of the blue, they have this really heavy, painful cycle, and they pass some tissue and they're like, what the heck was that? And they just have no idea that these birth control pills, although they're being told, hey, this is going to prevent you from getting pregnant, they have no idea that the conception is actually happening, but what it's preventing is implantation. And ACOG, the American College of Obstetricians and Gynecologists, has tried to rename when life begins, rather than saying that life begins at conception when the egg and the sperm come together, which we all know is the truth. I mean, you wouldn't have embryology textbooks ever saying that life begins at implantation. It's ridiculous. So when ACOG said this, and they're saying that, oh no, it's never an abortion to use Plan B. It's never an abortion if you don't have implantation because of a birth control pill. They're really just kind of telling a big fat lie. Mm-hmm.
And you look too at the stats, even Guttmacher, which, is, formerly the research arm of Planned Parenthood, says that the majority of women who seek abortions report that they actually were using a contraceptive at the time that they became pregnant. So it wasn't that they weren't using contraceptives and then said, oh no, I have to end this pregnancy. That, no, they actually thought they were being responsible and preventing life, but then there was a mistake. And so that, I mean, that's why we know, the birth control pill or other hormonal drugs can create these situations where you have an early abortion, because we know women who are on birth control. We all know someone who was on birth control and got pregnant. So we know it's not 100% effective at preventing ovulation. Can you talk a little bit about that? Because even, even within the pro-life community, I've heard folks kind of say, well, we don't know for sure. And I've actually heard good, well-intentioned pro-lifers who I love dearly say, well, I don't think that's the case. Can you explain the science just really clear? Because I mean, it says it on the birth control package that it can do this, but we have just kind of, I think, folks within the movement who still don't want to acknowledge it. And I think a lot of that's kind of it's personal, because if you're personally contracepting and it would change things. But explain how you could get pregnant if you're on the birth control or a pill or some other hormonal drug.
Absolutely. So when you look at any of the hormonal contraceptives, they all, if you look at their mechanism of action in the package boxes, and you read through, the first thing that the pills will say, at least the ones that have estrogen and progesterone, is that they try and suppress ovulation. Then they have backup mechanisms of action, such as thickening the cervical mucus to prevent the sperm from getting where it needs to get, or trying to harm the sperm. And that final backup mechanism of action for all of them is to make the inner lining of the uterus inhospitable. So it truly is playing a game of Russian roulette, because if, number one, if you're having a person who takes a pill every single day, but then suddenly has some sort of an infection and takes like Mucinex, or they take an antibiotic, and all of a sudden their cervical mucus is like through the roof and they're much, much, much more fertile, and that happens to be a month that, although they were on the birth control pill, it didn't suppress that ovulation. So they ovulated, the egg is present, the sperm, although that one sperm managed to make its way through the poor mucus and everything else, and it meets the egg. So now it's met this egg, it's created a pregnancy, and now the last backup mechanism of action of this birth control pill is to try and prevent implantation. Even when this happens, sometimes the baby will get aborted. Sometimes the baby will actually survive, but it'll be at higher risk for miscarriage because its lining is thinner. Whenever you have these low dose contraceptives, you're trying to shut down the hormonal pathways, and you're not getting enough estrogen and enough progesterone to build that lining and to stabilize that lining. That's why when people are on contraceptives, they don't have normally nice, heavy, moderate bleeds. They have this like spotting when it comes to the time of their period. So, so often, I remember when I was doing prenatal care for patients, there were so many patients that I delivered who were like, okay, this is my condom baby, this is my birth control pill baby, this is my IUD baby, where the baby came out with the IUD, with the sac. So it happens. The only way 100% to avoid pregnancy is to not have sex. That's it. And so the natural family planning, if you can actually identify those time periods that you can not have sex, then you have a much better chance of actually avoiding pregnancy than you would if you were using a birth control pill.
Yeah, it's a big discussion to have, and I think there's so much misinformation, especially even within the churches. I grew up in a Protestant church, and no one ever talked about the birth control pill, and that the fact that the birth control pill could be abortifactive. And so it's, I'm now Catholic, so now there's a deeper theology behind why the birth control pill is something that I wouldn't put in my body. But even speaking, I think this is something that can resonate with anyone. You don't have to be Catholic, you don't have to be Protestant, you can be agnostic or atheist. And you mentioned that earlier you have folks coming in who just want to be organic. who are living natural lives and don't want to be putting these artificial hormones into their bodies. So what can you tell me, I guess, before we get into this, because I really want to get into some of the side effects, and I want you to help explain for everyone what are some of the common side effects, what we need to be looking for. But I guess, how would you answer, or how do you answer that question? If you're at med school, you're having a conversation, and the kids, the students you're talking to say, fine, we get it. You're anti-abortion. You're not going to, commit abortion. But how can you say you're pro-life, but then not prescribe birth control? And that's what's reducing abortions in our country. Like, do you ever go into the stats of about how women who are contracepting are getting pregnant, and how we know from, I know Dr. Michael New, he was on earlier this season talking about some of his research studies. Even the research studies prove that more access to contraception doesn't decrease abortion rates.
Absolutely. So when I talk to people and these questions come up, that's exactly what I tell them, all of those facts. And I also really kind of hone in on, okay, if you're in a relationship and if you're trying to find that one person that you want to spend the rest of your life with, and you are, just at that dating stage, you're not engaged, you're not married or anything like that, I always talk about, why don't you consider just not having sex? Because that will truly allow you to truly understand what this person's intentions are for you. Are they only with you simply because they want to use you for their sexual pleasure? Or are they actually with you because they are interested in your mind, your heart, and your soul? And the only way that you'll ever know that is by saying, hey, I'm not going to have sex until I get married, or I'm not going to kiss on my lips until my wedding day so that I'm not tempted to have sex until I get married. And it may seem extreme to some, but the people who actually do it have so much success in their relationships. And then they're not dealing with this whole thing. So, I truly believe that the message that we have to give all of these people who are not married is the message of sexual integrity and chastity. I think that's really the pro-life message.
Well, what do you say then to someone who says, it is my right to have as much sex and have as much pleasure in my life, and who are you to deny me the pleasure that I seek? Legit question I get on campuses.
It is your right to choose to have as much pleasure and, whatever you want in your life, but then with that right comes responsibility. So if you're choosing to have sex with all of these random people, you are taking responsibility for, number one, the STDs that you are exposing yourself to, the HPV, the possible future cervical cancer. You are exposing yourself to the possibility of becoming pregnant with this person's child who may or may not be interested in parenting with you or supporting that child. You are taking responsibility for all of these things. So yeah, do what you want. That's fine. But when it comes to a completely different human being that you have now created, now you no longer should have that ability to do what you want, because now it's not your body that you're making choices over. Now it's somebody else's.
Yeah, and we saw that actually illustrated pretty clearly with the COVID-19 crisis of, yeah, it's your body, but when your body can harm someone else's body, you better put a mask on. You will social distance. And the states had no problem. Even the very pro-abortion governors had no problem telling people, well, yes, it's your body, but when your body can harm someone else, you can't use your body to harm someone else's body. And the state can tell you, no, you can't do that because you're harming an innocent, secondary person, which I was like, I feel like that's what we say in the pro-life movement all the time. But, it always comes down to the question of what is it? Is a human being inside of her? And they always, those who support abortion always try to deny. All right. So I'm going to get to the questions I'm sure everyone wants you to talk about. All right. I have been having painful periods, or I'm having some sort of hormonal imbalance. My doctors told me I have to go on the birth control pill. Sure. What is a reasonable person's response to that?
So it's really important to try and determine, are you interested in just covering up the issue and addressing some of the symptoms and then having to deal with it later when you're actually interested in having a child, and then finding yourself in a point of infertility because you haven't addressed your issues? Or would you prefer to actually understand what's going on with your body now, get to the root of the problem, and address those issues one by one so that you can, in general, be a healthier person with normal periods, no extended tail and brown bleeding, no horrible PMS symptoms? Or, you know, if you want to cover it up with contraceptives or antidepressants, you can do that as well. Nobody's forcing you one way or the other, but it's always your choice. And what would you like to do? That's really generally how we approach it.
Yeah, I mean, what are the common, I see like it's PCOS. I often hear on campuses of, I was diagnosed with PCOS. I've had women who come up to me and said, you know, the birth control pill is keeping me alive, and without the birth control, and I'm like, no, that's not how it's working. What are the other types of treatments? So like if you have PCOS, or like, what are the other things that, you know, women who are listening to this who have been diagnosed with something, when they go back to their doctor, if they can't get to Philadelphia and see you, if they can't get to Fairfax, Virginia and see Dr. Brashowski, and if they're too lazy to look up all the NaProTechnology licensed certified physicians, what are some of the things they can recommend to their doctor that they would like them to try or test before prescribing a hormonal contraceptive?
So the first thing is, anytime anybody comes in with abnormal bleeding, irregular cycles, I always say, check and see what's going on. You know, do a basic PCOS panel where you're looking for elevated testosterone abnormalities and LH and FSH levels. You're looking at a prolactin level. You're looking at thyroid function, a TSH and free T4 and free T3. You're looking at 17-hydroxyprogesterone. So these are all different labs that we kind of do all at once on day 3 of the cycle. And that's just kind of a quick smattering of different things which may be causing abnormalities in your cycle. Then the next thing is, if you can get somebody to chart their cycles, you know, just charting, okay, today I had heavy bleeding, next day was moderate, it was light, now it's very light, okay, it's very light and it's brown spotting and it's been like 3 days of that. And then paying attention to, when does the mucus show up in your cycle? So you're just like, when you go to the bathroom and you're wiping yourself, you're paying attention to, does it feel like I'm wiping an egg off the counter? Or does it feel like it's dry and my hands stop along the way? When you reach that point in your cycle that you actually feel that lubricated feeling and you look at the tissue and there's some mucus there and it stretches, you know you're in the middle of that fertile time. So if you can identify that last day of fertile mucus, that's what we call the peak day, that allows us to have a much better understanding of when you're ovulating, when you're not ovulating, if you're ovulating. And that also gives us a marker so that when we check estrogen and progesterone levels, we can see what is normal and what is not. If you're checking, like typical gynecologists, what we've been taught to do through residency is, oh, check a day 21 estrogen and progesterone level. But obviously, if somebody is ovulating later than that, that's not going to tell you anything. Or if somebody has ovulated way earlier than that, you really have nothing to compare it to be able to tell you what normal values are. So when we use this sort of like charting mechanism so we can identify when somebody is ovulating, then we can check labs like, okay, 3 days after ovulation, 5 days after ovulation, 7, 9, 11, and then we can compare their labs to what normal would be. And we can tell them, hey, your progesterone levels are obviously low, your estrogen levels are way high, and these are the treatments that would go along with that. Unfortunately, most gynecologists, when they take this information back to them, gynecologists in general are very afraid of being sued. And so they're not going to do anything outside the box of what ACOG says. And since ACOG has not said, you know, check hormonal profiles all the way through the month, they're not going to do it. But the good news is there's like a whole contingent of doctors that are NaPro based or work with, there's mycatholicdoctor.com, which is another telemedicine-based group where there's lots of NaPro-trained physicians within that can treat people all over the country as well, because they have licenses for all over the country. So if you can't find someone in your own area, I would definitely look into that, mycatholicdoctor.com.
That's awesome. What, aside from the ethical reasons of, how it could end a human life, what are the main reasons that, physicians shouldn't be prescribing birth control? I mean, these are synthetic hormones. Like, what are some of the risk factors that women really aren't being told about? It's, especially when they're being put on these drugs at 13 or 14 years of age, whether it's the shot or it's the pill. What are some of the things they need to be looking out for?
Absolutely. So with the shot, like the Depo-Provera shot, with the Implanon implant, things that have this really strong level of progesterone, which lasts for a long period of time, but it's a synthetic progesterone, and you're getting progesterone at the wrong times of the month because you're trying to shut down things in your body. Those patients tend to have issues with bone mass loss. And so you can't use it for more than 5 years, I believe, without putting yourself at risk for future osteopenia, osteoporosis, and things like that. You also have an increased risk of depression. You have an increased risk of weight gain than people who are on hormonal contraceptives like the pills. Anytime you take that synthetic estrogen, say you have some underlying blood clotting disorder that you have no idea about, you get on this pill, you could be putting yourself at risk for stroke, and you had no clue. And the way that you find out is you get a DVT or you get a PE, a blood clot to your lungs, which could be fatal, or you can get a blood clot in your legs, which can be super painful and also very dangerous. There are, if you read the package insert of all these things, there's increased risk of cancers. But I think the biggest issue is that it really does just shut down your natural cycle. And you're assuming that these hormones that you're shutting down only have one purpose. But God is so amazing in how he created us. And all of these hormones, like, we don't know enough medically to really understand what the job is of every one of these chemicals that we're trying to shut down. It's only when you have the side effects because of the lack of these things that you start to realize how you're impacting your body. And there's been work done on the fact that when people take hormonal contraceptives, it actually changes the way that they encounter people, how they,
that was going to be my next question.
The kind of people that they're attracted to changes. So can you imagine if you get on birth control pills when you're in high school, you stay on it all the way through until you're married and you're about to have children, and then you get off of it, you might find that you're not even attracted to your spouse anymore. How crazy would that be?
And that's, and that's not like a conspiracy theory. That's like science. There was episode, I think it was like Good Morning America not long ago. And this Baylor researcher, she was a neurobiologist or whatever. She had done a study, and that's what happened to her. She was on birth control, got married, decided to get off, and was having all of these marital problems with her spouse. She no longer, she said, sexually desired her spouse anymore. Oh no, actually she was opposite. Her sex drive went up. And so she had basically had a suppressed sex drive this entire time. And then suddenly she goes off birth control, and that got her thinking, what else was this doing to my brain while I had been on it for years? And it was fascinating. All the women at the, I think Good Morning America, they were on the couch, but it was so, they all preface it with, we're not saying birth control is a bad thing. In fact, birth control has been liberating for women across America. And then you have a doctor who says that and confirms that, and then goes on to say, yeah, but it also alters our actual brain function and the way we think. And then I'm like, how could you? But the disconnect there of not being willing to maybe say, maybe we need to change the way we live our lives a little bit. And maybe not have sex with that guy that we're not intending to marry or build a family with, but they're not willing to say that. So that it's like birth control is awesome. because it's going to let you do what you want. Like you're going to have as much sex as you want, but it also is going to change your brain. I mean, it's so sad. It's just such a level of poverty. But yeah, I mean, I think that's interesting because I've said that before and people kind of looked at me like I was crazy, but now I'm like, it was a Good Morning America. I'm not lying, you know, and then that like somehow validated the reason. What about long-term infertility? So if someone who's on birth control for a long time, they get off it to have children, is there infertility risks there?
So definitely, I think the main issue with the infertility risk is the fact that by using the birth control, they have been hiding or masking the underlying issues that they should have addressed early on. And those issues just got worse and worse and worse under the influence of the birth control pill because they've just been shutting down their cycle. They'll have a rebound, elevated estrogen level at times, which can really interfere with their ability to ovulate properly. But also, it's just, there are certain kinds of birth control pills that will render you without cycles or without the ability to ovulate for several months. So like the Depo-Provera shot, oftentimes when people stop using the shot for at least 6 months, possibly up to a year, they can't have any periods. They no periods whatsoever. They're not ovulating because these chemicals have just shut down their system. So absolutely, these synthetic hormones can cause major issues with fertility as well. But yeah, it's really quite sad because oftentimes, you know, people will have this underlying, hey, I have a little bit of PMS, I have some tail and brown bleeding, or I have longer cycles. But because everybody around them has kind of similar symptoms or variations, or they're just not talking about it, they believe that since that's what they've always had, that it must be normal. And so if they don't talk to someone, and if you go and talk to a typical gynecologist, they'll say things like, oh, a normal cycle is anywhere between 24 and 34 days. And I'm like, what? How could that possibly be a normal cycle? You know, like if you're over 30 days, you probably have some issue with thyroid or some issue with PCOS. If you're under, 27 days, or if you're under 27 days, you probably have lower levels of progesterone. And if you don't address those things, when it comes time to actually conceive a pregnancy, you're going to have a lot of issues. And then they'll say, oh, you should just go and see an IVF doctor because they don't know what else to do.
So let's talk about IVF then. So this is something, once again, I think, especially coming from the Protestant church, it is not discussed what IVF is, what the procedures entail, how human life is being created. It's just not talked about. And IVF is a hard thing to talk about because so many of us know of children, either in their families or friends of, children of our friends who were conceived in IVF. I actually had someone from my college, one of my college roommates, contacted me over Facebook recently, very angry because I had said something about IVF and she had conceived her child and she said, I'm very pro-life. I'm against abortion. And I consider those embryos, they're my children. And I have 5 children. And I said, but you have them frozen. Is that what we do to our children? And she didn't respond back. Probably should have been nicer about it. But it was frustrating. It's just like, well, didn't you look into how they can do IVF? Like you say you're pro-life, but didn't you know? Can you explain just to folks what happens in the IVF process? And then let's maybe talk a little bit about, women are coming in or maybe hearing this and themselves are experiencing infertility, maybe some alternatives, places they can look for hope.
Absolutely. So first of all, with IVF, what happens is they'll ask the woman to take medications to hyperstimulate her ovaries and produce as many possible retrievable eggs that they can possibly get. Then they put in a needle and under ultrasound guidance, they try and remove as many of these eggs as possible. They give the man some pornography, they send him into another room, they ask him to masturbate, collect a sample, clean the sample, pick out the better sperm and mix it with these eggs that they've produced. Then you have the first stage of life when the egg and sperm come together and they create embryos. And absolutely, I believe that every single one of those embryos that have been created are these people's children. The next step is they look at these embryos and they grade them. They'll say, okay, you're of this quality, you're of this quality, you're of this quality, and let's discard the ones that are of poorer quality, because those are less likely to give us a good, healthy pregnancy. And so when they have, however many embryos that are left over, and these people have already lost children through that initial discard, then they say, okay, we are only allowed to place 2 of these embryos in this first fresh cycle. So the rest of the embryos that you have, so say you have 6, we can place 2. The other 4 need to go into the freezer, and you'll have to pay for that every month to keep them viable. They place these 2 babies into the uterus, these 2 embryos, and say, if one of them takes off and the other one passes away, then they're okay with that. If both of them take off and you have twins, they're still okay with that. If one of them switches into a twin and now you have triplets, or if both of them become twins and you have quadruplets, the next question is, hey, now you have a very dangerous triplet or quadruplet pregnancy. We really recommend that you reduce. Reduce means to abort. So these people who have been dying for one child are now faced with, okay, we want you to kill your children. And so most of these parents are so afraid at that time that they won't be able to have their one child that they agree to the reduction. And then now they have 4 more babies in the freezer that they have to go through this another at least 2 times. And that same process of possible reduction and everything else. So it's just completely fraught with horrible, horrible possibilities.
Mm-hmm.
And the children who have been frozen have a higher, and actually all of these children have a higher likelihood of cancer. They have a higher likelihood of genetic anomalies simply because of the manipulation that takes place prior to placing these embryos into their mom's uterus. And so, these kids that have been frozen, now they have to be thawed. That has effects on their genome. And so there are absolutely, studies out there that show that they have a higher risk of cancer.
Mm-hmm. That's so sad. And you didn't even touch upon you said that they grade these embryos, but the eugenics that happens is very real inside these facilities. Oh, this embryo has CF, discarded.
Mm-hmm.
Oh, by the way, would you like to, maybe before you discard it, would you like to donate to science? This embryo has Down syndrome. And they're literally just throwing away or donating to science. So they'll be destroyed in scientific research, human beings, simply because of their genetic code. I mean, I can think of nothing else that's more discriminatory than that practice. And it's actually really hard. We hear it a lot in the CF community because the male, CF sufferers, 98% are infertile. So the only way to have biologic children is through IVF. And then as well as, the parents are told, IVF is a good way to go because we know that CF children have to be 6 feet from the other CF children. And so CFers are never hanging out together. And so it's very rare. Like, for example, I have 2 children with CF, and it's very rare. And so there's whole groups online of these parents who have a beautiful child who has CF, who then have undergone IVF to then throw away other children that they created who have the same genetic code, a similar genetic code to their child who's alive, which I think from the psychology of that, of, well, wait a minute, I lived, but you threw away, my brother and sister.
Yeah.
It's very frustrating to be in those conversations. I get into them a lot online. But it's also the thought, though, too, of I deserve to have a kid. It is my right to have a kid and to have a child. So therefore, IVF is the way for me to achieve that right, which I would say it's not really your right to have a child. But I don't know if you have something you can add to that.
No, absolutely. And I encounter women all the time within my office who come to me who have gone through the IVF process or right smack dab in the middle of the IVF process. And when I talk to them and I kind of let them know, hey, I don't know if you realize, but this is what is going on. And they, their response, you know, some of them are like, oh my gosh, I had no idea. And others are just honestly in this place of desperation. It's very sad to see.
Yeah.
And they say, you know, I'm getting up there in age and I'm just really concerned because I just really want a baby. And I always talk to them, I'm like, look, you know, there are so many ways that God can grow your family. He can grow your family through adoption. He can grow your family through foster. He can grow your family by you being the person on the block that every child wants to gravitate towards because you make the best cookies and you have the best listening ear. Like you can grow your family a million different ways, but you don't have to resort to this. And, you know, the fact that they're in the office to start off with is a really good sign because, you know, that usually leads to them doing the follow-up work and checking hormones and trying to figure out what's going on. But
what's the hope?
Yeah.
So for those who are listening or know someone who is struggling with infertility, I mean, we obviously want every woman who wants to become a mother. We want her to become a mother. That's the business we're in, right? Is pro babies. But what are some resources and alternatives that she can seek out within her community to get the help that she needs and maybe solve some of these challenges?
You know, there are so many options, and I believe, you know, the best way to go about it is to find a doctor who has an understanding of cycles and hormones to be able to really understand what the underlying issue is. I think one of the most dangerous and difficult things that women have to encounter when they're on this fertility path is somebody in the medical field telling them that they have unexplained infertility. That whole unexplained infertility thing is basically saying, hey, every test we've done on you is perfect, and we have no idea why you're not able to conceive. And every single one of those unexplained infertility people that has come to a NaPro doc, in my office for sure, we have always found things. We found issues with mucus. We found issues with hormones. We found issues with, you know, the lining of the uterus. And it's all very evident with just a little bit of work. So there is so much hope for these women that they don't have to spend thousands and thousands of dollars and create GoFundMes to pay for their IVF treatments. They could actually have all of their care paid for by their insurance companies because with NaPro, we're addressing actual medical issues that are covered. And then there's the whole alternative spectrum as well. You know, like you can go for a pregnancy massage. You can go and see a naturopath and find out if there are any chemicals or supplements that might be beneficial for you to address adrenal issues or thyroid issues. And you can reduce your stress and you can focus on living in a state of gratitude. And all of those things, you know, by reducing your stress, you actually improve your chances of ovulating in a much better way with a healthier ovulation. So all of these things play in. There's so many things that can be done. So finding a doctor who believes in the holistic method where they're not just addressing your uterus or your hormones, but actually addressing all aspects of your life, you know, your faith background, your beliefs, your relationships, everything, so that you can be in the best possible place when you're trying to conceive your pregnancy.
That's awesome. What would you say? I got one more medical question and then a broader question. I guess what advice would you give to someone who might have an IUD? So I hear this sometimes, people saying, well, I am going all natural. I have a copper IUD. And I'm like, oh, okay, let's just stop and talk about this. I mean, can you explain the differences between the two different types of IUDs and the risk factor? I mean, Planned Parenthood's been pushing these very hard. I know in the state of Colorado, they had this huge grant. They were taking girls out of the high schools, implanting the IUDs, and then it was this huge success story because they said, look, we lowered the teen birth rate because we inserted an IUD in all of these girls without their parents even knowing this. And I'm like, oh my gosh. But they actually get more money per IUD than they get the birth control pill. So it's actually a money-making scheme for them. But can you explain just what the two different types are and the risk and like how they operate and the risk factors? Because these are some horrific devices.
Yeah, I hate IUDs. My favorite thing to do in my office is to remove them. It makes me so happy when I have the opportunity to remove an IUD. It's so joyous. Okay, so IUDs, there's two types of them. One of them is a hormonal-based IUD, which has progesterone in it. That's the Mirena IUD, and they actually have a very small one called the Skyla, which is the same thing, which is created for women with very small uteruses or teenagers. So they're putting these in kids who are like 13 years old, sometimes without the consent of their parents even. Okay, so the way that the Mirena IUD works is they put it in place and it is constantly secreting progesterone. And progesterone is a good thing if it's a natural form of progesterone and if you're taking it at the right time after ovulation. If you have progesterone outside of that time, it serves to completely mess up your cycle and tries to shut down your ovulation. But the thing with the IUDs is that they're not successful in shutting down ovulation. So they might say, like, I remember talking to a Mirena rep, and he was this Catholic Irish guy, and he was like, Dr. Ruberu, I am an Irish Catholic. I would never, ever ask you to place something in a patient that's an abortifacient. That would be against my faith. And then lo and behold, I looked at the package insert and it very clearly states that it's not successful in shutting down ovulation for these patients. So every month, maybe after the first few months, they are ovulating every single time. But the main goal of this thing is to thicken the cervical mucus and to prevent implantation. So that's the one that has the progesterone. The copper one is even worse because this is releasing a little bit of copper every day into your system, and it's creating a very toxic environment within your uterine lining. And in this one also, you're not trying to shut down ovulation whatsoever. So you're ovulating every month, but it's preventing implantation once again. During an early pregnancy, sometimes they will insert a copper IUD to perform an abortion for somebody. These things have horrible side effects. Like you can actually perforate through a uterus when you're placing these, and then the body will like wall it off. You can become septic. I mean, we have had numerous cases of people that they had to go in and do a laparoscopy to retrieve an IUD, which was outside of the uterus in the abdominal cavity. Sometimes they'll just get completely stuck within the muscle of the uterus, and it'll just kind of get wedged in there into the muscle rather than being in the cavity of the uterus. And then that causes a lot of abnormal bleeding and pain. For all of these people, they tend to have abnormal bleeding and spotting and stuff like that as well. So yeah, IUDs are horrible.
They're terrible. And just to be clear, like ACOG changed the definition of pregnancy from, when egg and sperm unite and that new genetic code comes into existence, now it's implantation. So they'll say, oh, it's not an abortion. It's not an abortion. Well, yeah, it is. The unique human life was created in the fallopian tube, traveled down to the uterine lining, but then couldn't implant. So what else would you call that? They literally changed the definition of pregnancy to allow for hormonal contraceptives, IUDs, and to be able to say it's not abortifacient. And yeah, it's absolutely crazy. What do you tell someone who's on an IUD? Just get off as fast as possible, go see a doctor, and get it out?
I always tell them, come to my office, I'll pull it out for you anytime. It's just one of the worst things, honestly. I absolutely hate IUDs. Yeah, I always tell them, take it out.
Yeah, it's terrible, terrible. All right, so last question. Then I have to go bake chocolate chip cookies with my kids for another webcast I have to do. I wanted to ask you about feminism. We hear a lot of definitions about feminism. There's always a question of, are you really a feminist? what would you say to someone who says that, well, I'm a feminist, I'm a proud feminist, and yet his using artificial contraception, these artificial hormonal contraceptives, is, proud of the abortions that she has paid for. Do you think that is feminism when someone is suppressing a natural function of their body every month?
No, I mean, true feminism is having a love of the feminine body, the willingness to honor and to protect and to just hold up high this feminine individual and everything having to do with femininity. So it's not trying to suppress your natural cycles. It's not trying to hide what you have been created as. It's not trying to harm anyone, or especially your children that you have produced. It's not allowing or promoting the use and abuse of women through the use of contraceptives and sexual immorality. It's all about, helping people to understand their worth and their beauty and how precious they are. That's what true feminism is, standing up for a woman's right to advance, emotionally and, in intelligence and in studies, so that she can speak eloquently and be able to affect the world in beautiful ways. And that has nothing to do with contraception. That has absolutely nothing to do with shutting down your cycle. You talk to these young girls, true femininity is allowing them to grow within themselves and give them a voice so that they can share the talents that they have been given to impact the entire world. So, yeah.
Well, there you go. You just heard it from the good doctor right there. That's what true feminism is. Thank you so much, Dr. Monique, for coming on and sharing some of these hard truths with us. Hopefully got a lot of people thinking. Where can folks go if they've listened and they have a question and maybe need to have a consult with you, even if they're not in Philadelphia?
Absolutely. So my website for my office is naturalwomenshealth.com. I have a speaking website, which is Dr. Ruberu for Life, the number 4 life.com. I'm readily accessible through Facebook. You can just search for Monique Ruberu, or on YouTube. I have a YouTube channel, Dr. Monique Ruberu. So super, super easy to find me. And if you shoot me messages through either my websites or through Facebook or anything, I'm happy to respond and help you out.
Yeah, definitely. Please get connected with Dr. Ruberu. I always mess it up. If you have a question, because she is there to help. And there's a whole army of physicians like her who are trained, who can help you get to the root cause and can answer some of these questions that you've been having. But you're the one who's going to have to take the lead and have that conversation with your OBGYN and really start getting to the root cause of some of these issues you're having. So thank you so much, Monique, for coming on. And thank you all for tuning in today. I hope this discussion was helpful for you. I hope it got you thinking about a lot of things and maybe it challenged you a little bit. But if it did, thank you for continuing to listen and to hear us out and to hear a new opinion and maybe some new information. So thanks, guys.